As an ER nurse, have you ever taken care of someone who was alert and responsive, but their lab work or imaging told a far different story as to how seriously ill they really were? I'll never forget this one shift last winter. This lady walks into our ER around 2 a.m., probably in her 70s, carrying this little floral purse and wearing a cardigan that looked like something my grandma would wear. She comes up to the desk with this sweet smile and goes, "Hi, honey. I'm so sorry to bother you this late, but I think I caught a little stomach bug." Her name was Eleanor, and she was the politest patient I'd seen all week. While I'm checking her in, she's asking about my shift, complimenting my scrubs, even apologizing for coming in so late. She keeps saying things like, "I just feel a bit dizzy," and "My tummy's been acting up for a few days." Nothing crazy, just your typical older lady with what sounds like a minor bug. She sits in the waiting room reading some romance novel, occasionally sipping water from this little bottle she brought. When I call her back, she's still chatting away, telling me about her cat Whiskers and how she lives alone, but her neighbor checks on her sometimes. Super normal conversation. I take her vitals, and everything looks mostly okay. Heart rate's a little high at 95, but nothing that screams emergency. Blood pressure's fine, temperature's normal. She's sitting there asking if she can get some tea because hospital water always tastes funny. I'm thinking this is gonna be a quick visit, maybe some IV fluids and send her home. Then I draw her blood for the basic labs. Standard stuff, complete blood count, basic metabolic panel. She doesn't even flinch when I stick her, just keeps talking about how her garden's doing this winter. I send the labs off and tell her the doctor will be in soon. About 30 minutes later, I'm charting when my phone buzzes. It's the lab calling, which never happens unless something's really wrong. The tech goes, "Hey, you need to get the doctor now. The patient in bed 7, her sodium is 118. I literally stop writing. Normal sodium is like 135 to 145. Anything below 125 is dangerous. At 118, people should be seizing or unconscious. I look through the window at Eleanor, who's still reading her book, occasionally adjusting her glasses. She looks completely fine. I grab Dr. Kim and show him the results. His face goes white. We rush into her room and she looks up with this bright smile like, "Oh, are we all done? Can I go home now?" The doctor starts asking more questions. Has she been vomiting? Not really, just a little nauseous. Any headaches? Maybe a tiny one? Confusion? She laughs and says, "Well, I did forget where I put my keys yesterday, but that's nothing new." Here's the scary part. Her body was literally on the edge of shutting down and she had no clue. Dr. Kim explains that her sodium being this low means her brain could start swelling any second. One wrong move and she could seize, go into a coma, or worse. We start her on this super carefully controlled IV drip. You can't fix low sodium too fast or you'll cause brain damage. It's this delicate balance where we're basically trying to save her life in slow motion. Eleanor keeps asking if she can go home to feed Whiskers. She doesn't understand why we're keeping her overnight for a little stomach bug. She's texting her neighbor about picking up her mail, completely clueless that she almost died walking through our doors. Around hour 3 of her admission, I'm checking on another patient when I hear the monitor alarms going off in her room. I run in and Eleanor's having a full seizure. Her whole body's convulsing, eyes rolled back, the works. It lasted maybe 2 minutes but felt like forever. When she comes out of it, she's confused and scared. She keeps asking where she is and why her tongue hurts. Dr. Kim explains what happened, and for the first time all night, she looks genuinely frightened. The craziest part? If she hadn't walked into our ER when she did, she would have gone home, fed her cat, maybe watched some TV, and probably died in her sleep thinking she just had a stomach bug. Her neighbor wouldn't have found her for days. We kept her for 4 days, slowly bringing her sodium back to normal. By day 3, she was back to her chatty self, showing me pictures of Whiskers and asking the other nurses about their families. She had no memory of the seizure, which is probably for the best. When she was discharged, she hugged me and said, "Thank you for taking such good care of me during my little stomach bug." I didn't have the heart to tell her how close she came.